Welcome back to the Deep Dive,
It's great to be back.
where as always, we take these really complex topics and try to break them down.
Make them digestible.
Exactly. And today we're diving into the 2024 World Drug Report.
From the UNODC.
Yes, the United Nations Office on Drugs and Crime.
Yeah.
So this is like the yearly checkup,
Annual physical for the world drug problem.
Exactly.
Yeah.
Yeah, and it's packed with information and insights into, production, trafficking, consumption.
And all the points in between.
Yeah, and I think this one's a real eye-opener.
Yeah, this year's report is, it's a doozy. There's a lot to unpack here.
Yeah, it's not just about the statistics. It's about connecting the dots, between this industry and global instability, organized crime, the human cost of addiction.
Yeah, the human cost is a really important part of this report, and they really highlight that.
Yeah, it's crystal clear that organized crime is expanding its drug trafficking operations.
Taking advantage of instability, to make a big profit.
Yeah, and leaving a trail of suffering and violence in its wake.
Yeah, and one of the most shocking examples of this is the surge in cocaine production.
Yeah.
We're talking record highs, over 2,700 tons produced in 2022.
And where there's cocaine, there's violence. And the report highlights how countries along that supply chain are becoming increasingly dangerous.
Absolutely.
Take Ecuador, for example. They've become a major transit hub.
Right between 2019 and 2022.
Cocaine seizures and homicide rates increased fivefold.
It's unbelievable.
That's insane.
That's a staggering statistic, and it really underscores how interconnected these issues are,
Yeah.
Demand in Europe and North America is fueling violence and instability, thousands of miles away.
Yeah.
It's a real stark reminder that the choices we make as consumers have real-world consequences.
Speaking of consequences, let's talk about Afghanistan.
Oh, boy.
In 2022, the Taliban implemented a ban on opium cultivation, and the effects have been dramatic,
Dramatic is an understatement.
to say the least.
It's been a seismic shift.
Yeah.
Opium production in Afghanistan plummeted by 95% between 2022 and 2023.
Wow, 95%.
That translates to a 74% drop in global opium production.
Wow, so a huge chunk of the world's supply just vanished.
It's essentially gone overnight.
I can only imagine what that's done to the Afghan economy.
It's been devastating, especially for Afghan farmers.
Yeah.
The report shows that their income from opium has plummeted by 92%.
92%.
Many are facing extreme poverty.
Wow.
They're being forced to choose between starvation and other illicit activities.
So this ban, while well-intentioned, might actually be fueling more instability.
Yeah, it's a real concern. You try and put out a fire with gasoline.
Yeah.
And on the other side of this, you have traffickers who are sitting on stockpiles of opium and heroin.
Right.
They are reaping huge profits from these artificially inflated prices.
Yeah, winners and losers.
In a very tragic way.
Yeah, what about the ripple effects beyond Afghanistan's borders? I'm guessing this is causing major headaches globally.
Absolutely. The report warns of potential heroin shortages and price hikes in major markets around the world. And that's not all. There's a real fear that this could lead to increased use of even more dangerous synthetic opioids.
Like fentanyl.
Like fentanyl.
So pushing people towards even riskier alternatives.
It's a grim reality.
That's terrifying.
And even with the opium ban, we're seeing signs that Afghanistan's drug economy is adapting.
Wow.
There are growing concerns about a potential shift toward methamphetamine production.
So it's like whack-a-mole.
Yeah. Cut off one head and two more grow back. It's a hydra.
Yeah, so we've got instability and shifting production in Afghanistan, but meanwhile the cocaine trade is booming.
Like never before.
It's a truly globalized market reaching every corner of the planet.
Yeah, cocaine has become a ubiquitous problem.
Yeah.
In 2022, we saw record highs, over 2,700 tons of cocaine produced globally, with seizures also hitting a record over 2,000 tons.
The record production, record seizures, and it's not just limited to North America and Europe anymore.
This expansion is creating new markets in regions like Africa and Asia. It's fueling violence and instability in transit countries and stretching law enforcement to its limits.
And even though North America's cocaine market might be contracting slightly?
Europe is experiencing an unprecedented surge in use.
Really?
Yeah, in some cities, usage has skyrocketed by 80% since 2011.
Wow, 80%.
It's alarming.
And it's not just powder cocaine.
No.
Crack cocaine is making a comeback too.
Unfortunately, yes. The number of people seeking treatment for crack cocaine use in Europe has tripled between 2014 and 2021.
Wow, tripled.
Yeah, it's a potent and addictive drug that can have devastating consequences for individuals and communities.
So the cocaine problem is evolving and spreading.
And speaking of evolving drug problems, we can't ignore the rise of synthetic drugs.
Right.
It's like we're in an arms race where the drug trade is constantly one step ahead,
Yeah.
creating new, more potent, and even more dangerous substances.
The report mentions that millions of people are using amphetamines, and MDMA and wastewater analysis suggests those consumption levels are climbing in several regions.
It seems like every time we think we've got a handle on one drug, another one emerges from the shadows.
That's the challenge with synthetic drugs. They can be produced practically anywhere.
Right, with readily available chemical inputs and relatively short production times.
So tracking and controlling them is a nightmare.
Exactly.
And then you add in the unknown pharmacology
Right, lack of effective treatments.
and dangerous drug mixtures.
Like pink cocaine, a mix of ketamine and MDMA and happy water, which can contain anything from methamphetamine to ketamine to heroin.
Oh, wow.
The risks are astronomical.
People are playing Russian roulette with their lives.
And of course, we can't forget the role of synthetic opioids like fentanyl in the ongoing overdose crisis,
Yeah.
particularly in North America.
It's a public health emergency.
A stark reminder of the urgent need for effective harm reduction strategies, public awareness campaigns, and expanded access to treatment.
And while fentanyl might be dominating the headlines, the methamphetamine market is still a major player. It might be flying under the radar, but it's not going away anytime soon.
That's right. Global methamphetamine seizures declined slightly in 2022,
Okay.
but experts believe the global market might actually be expanding.
Wow.
It's just shifting and adapting to new challenges.
So the report dives into some of those shifts,
Yeah.
highlighting some interesting regional trends.
Yeah, it points out that while North America and Southeast Asia are still the biggest markets for methamphetamine seizures are increasing in other regions,
Yeah.
the Near and Middle East is emerging as a significant market, and there are worries about the potential convergence of the captagon and methamphetamine markets.
Capagon, what is that?
It's a highly addictive amphetamine-type stimulant
Okay.
that's become a major problem in the Middle East. It's often linked to conflict and instability in the region,
Wow.
often used by combatants to enhance alertness and suppress fear.
So we're seeing a globalization of the synthetic drug problem.
Yeah, mirroring what we're seeing with cocaine.
Wow.
New markets are opening up, new consumers are being drawn in.
Okay, we've covered the heavy hitters, cocaine, heroin, synthetic opioids, and methamphetamine. But the report also shines a light on some alarming trends in Africa's drug scene.
Yeah, it's no longer just about cannabis.
That's a critical observation. Cannabis remains the most widely used and harmful drug in Africa.
But the continent's becoming a major transit point for cocaine, heroin, and methamphetamine.
And that's leading to increased local consumption, which I imagine is putting immense strain on healthcare systems that are already stretched thin.
Exactly. It's a double whammy. And the report reveals some concerning statistics.
Like what?
Over 90% of global tramadol seizures occur in Africa.
Tramadol, that's a pain reliever.
It is. But it's also a synthetic opioid, and its non-medical use is a growing concern in Africa and the Middle East.
Okay.
It can be highly addictive, and in high doses, it can cause respiratory depression seizures and even death.
Wow. So on top of the influx of hard drugs, they're also grappling with the tramadol crisis.
Yeah, and to make matters worse, you have these homemade drug mixtures,
Oh, wait.
like Nailpe Karkubi and Kush.
What are those?
These concoctions are incredibly dangerous.
Yeah.
Nailpe, for instance, is a terrifying mix of low-grade heroin, cannabis, antiretroviral drugs, and often rat poison.
Rat poison.
Karkubi is another dangerous mix, typically combining cannabis with prescription medications like benzodiazepines or pain relievers.
Wow.
And Kush is a synthetic cannabinoid often sprayed onto dried plant material and sold as a cheap alternative to marijuana.
So these mixtures are really unpredictable and potentially deadly.
The problem is these synthetic cannabinoids can be far more potent and dangerous than natural cannabis.
So we're looking at a perfect storm in Africa.
Yeah.
Increasing use of traditional drugs like cannabis, the emergence of new synthetic drugs, and these homemade concoctions with unpredictable and potentially deadly effects.
It's a deeply concerning trend.
Yeah.
It really underscores the need for a multifaceted approach that prioritizes prevention, harm reduction, and treatment.
Oh,
And it has to be tailored specifically to the unique challenges facing the African continent.
absolutely.
Welcome back to our deep dive into the 2024 World Drug Report,
Picking up where we left off.
exploring those alarming trends and the challenges that are highlighted in this year's report.
Last time we discussed the explosive growth of the cocaine market, the concerning rise of synthetic drugs, and the evolving drug landscape in Africa.
Right, and now let's kind of dig into some of the data points that reveal just how widespread this issue really is.
One thing that really hit me was the sheer scale of the problem.
Yeah.
The report estimates that nearly 296 million people used drugs in 2022.
Yeah.
That's roughly the entire population of the United States.
It's a staggering figure, and it represents a 23% increase compared to just a decade ago.
So population growth plays a role.
Sure.
But it's clear that drug use is a growing global concern.
Absolutely.
And if we're talking about widespread use, we have to talk about cannabis.
Of course.
It remains the most widely used drug worldwide.
With an estimated 232 million users in 2022.
And while cannabis is often perceived as less harmful than other drugs, the report urges caution.
Yeah.
The increasing potency of cannabis products
Right.
and the rise of harmful patterns of use are raising serious concerns about its impact on mental health and overall well-being.
Absolutely. It's not your grandpa's weed anymore.
Exactly.
Today's high-potency cannabis can be especially risky for young people, impacting brain development, increasing the risk of mental health issues later in life.
The adolescent brain is still developing, and exposure to those high levels of THC can have lasting consequences.
Yeah, we need to prioritize those early intervention and prevention programs to address youth cannabis use.
Yeah, it's all about protecting those developing minds.
Absolutely.
And speaking of harm, the report doesn't shy away from the devastating consequences of drug use overall.
No, it doesn't.
It estimates that over 64 million people worldwide were suffering from a drug use disorder in 2022.
And that number is likely an underestimation.
Yeah, because of the stigma surrounding addiction.
Yeah, and the barriers to seeking help.
It's a hidden epidemic, and beyond the individual suffering, we need to remember the impact on families, communities, and healthcare systems.
The ripple effects are enormous.
Yeah, drug use fuels crime, violence, poverty, health problems, placing a heavy burden on societies around the globe.
It's not just a personal struggle, it's a societal challenge.
And the report emphasizes the disproportionate impact on certain populations.
Like homeless individuals and displaced communities.
Right. They're often caught in this vicious cycle.
They face multiple vulnerabilities.
Making them more susceptible to drug use and its harms.
And they often lack access to basic healthcare services.
Including drug treatment and harm reduction programs.
It makes it even harder to break free from addiction.
Yeah. Addressing those inequalities and ensuring equitable access to care is essential.
Absolutely.
We need to provide support where it's needed most.
Agreed.
Now let's talk about how the world is responding to this crisis. One thing that jumped out at me was the sheer number of people caught in the criminal justice system for drug offenses.
It's a staggering number. In 2022, an estimated 7 million people worldwide had formal contact with the police for drug offenses.
7 million lives entangled in the legal system.
Because of drugs.
And the report makes a really important distinction between those arrested for drug trafficking and those arrested for personal drug use or possession.
Yeah, it's a critical distinction.
The vast majority of those arrests, about 2/3,
were for personal use or possession.
So are we criminalizing addiction instead of treating it? Are we using our resources wisely?
These are the questions policymakers need to grapple with.
Exactly. The report highlights some interesting regional variations in how drug offenses are handled.
For example, Europe has the highest rates of arrests, prosecutions, and convictions for both drug trafficking and drug use or possession.
So a stricter approach across the board. What about other regions?
Well, the Americas have a high arrest rate for drug use or possession, but the lowest conviction rate for such offenses.
So lots of arrests, but fewer convictions. What does that tell us?
It points to differences in law enforcement practices.
Right.
Judicial systems, societal attitudes.
Yeah, it highlights the need for a more nuanced and evidence-based approach.
One size doesn't fit all.
Okay, so we've got varying approaches to law enforcement, but what about treatment?
Right.
The report paints a sobering picture of the global treatment gap.
Yeah.
It's not just about arrests and convictions. It's about getting people the help they need.
And the report estimates that only about 1 in 11 people with drug use disorders received treatment in 2022.
That's a decline from previous years.
Despite the growing need.
So the problem is getting worse, but access to treatment is shrinking.
It's a heartbreaking paradox.
Yeah. Global crises like the COVID-19 pandemic have disrupted healthcare systems.
And made the situation even worse.
And as we discussed earlier, there are significant regional disparities in access to treatment.
Yeah, Europe and Oceania have the highest treatment coverage, while Africa and Asia are lagging behind.
Expanding access to evidence-based drug treatment is crucial.
Yeah, it's an investment in human lives and the well-being of entire communities.
And it's not just about availability.
Right.
The report emphasizes the need for affordable, accessible, and culturally sensitive treatment options.
Absolutely. Treatment needs to be tailored to individual needs and circumstances.
There's no one-size-fits-all solution.
And we need to break down the stigma and discrimination that prevent people from seeking help,
It's about creating a safe and supportive environment.
where people feel empowered to get the help they need.
Now let's talk about drug policy reform. It's a hot topic, and the report delves into some of the ongoing debates.
Particularly around the legalization or decriminalization of cannabis.
Cannabis policy has been a whirlwind of change in recent years.
It has.
The report examines the experiences of jurisdictions that have implemented these reforms, particularly in North America, highlighting both the potential benefits and the unintended consequences.
Right, so it's not a simple black and white issue.
There are pros and cons to consider.
Legalization can reduce arrests and generate tax revenue.
Okay.
Canada, for example, has seen a significant decrease in cannabis-related arrests since legalization.
Oh,
And that revenue generated from cannabis sales is being used to fund important social programs.
okay. But there are also potential downsides,
Of course, legalization can lead to an increase in cannabis use.
especially among young adults.
It's like anything else. Easier access can lead to increased consumption.
Right. And it's not just about the number of users.
It's about the potential risks associated with those more potent products.
Yeah, the report expresses concern about the diversification of cannabis products
Many with very high THC content.
and the potential health risks associated with vaping cannabis.
We need to proceed with caution.
It's a balancing act. We need to weigh the potential benefits against the potential risks
Absolutely.
and prioritize public health and safety in all those policy decisions.
Agreed.
And while the spotlight is often on cannabis, the report also sheds light on the growing interest in psychedelics.
It seems like everyone's talking about magic mushrooms and ayahuasca these days.
There's been a surge in research and advocacy surrounding the potential therapeutic benefits of psychedelics.
Particularly for mental health conditions like depression, anxiety, and PTSD.
But the report cautions against rushing into widespread decriminalization or legalization
We need more research.
to fully understand the potential benefits and risks.
Absolutely. We need to be cautious and responsible.
Yeah, appropriate safeguards need to be in place to ensure that these substances are used safely and ethically.
Right, and it's important to differentiate between the potential therapeutic applications of psychedelics and their recreational use.
Yeah, it's a critical distinction.
Yeah.
Blurring those lines could lead to unintended consequences.
And jeopardize public health.
Navigating these policy debates requires a balanced and evidence-based approach
We need to carefully weigh the potential benefits against the potential risks.
and prioritize public health and safety above all else.
Agreed.
It's about making informed decisions that protect individuals and communities. Okay, so we've delved into the data, the challenges, and the policy responses outlined in the 2024 World Drug Report. It's clear that we're dealing with a complex and evolving problem.
That demands a comprehensive and multifaceted approach.
And as we explore potential solutions, there's one crucial aspect we must not overlook.
The human rights dimension of the drug problem.
That's right behind the statistics and policy debates are real people whose lives have been touched by drugs.
The report dedicates an entire section to this.
Exploring the right to health in the context of drug use.
It emphasizes that everyone, regardless of their drug use status, has the right to the highest attainable standard of physical and mental health.
That means access to quality healthcare services, including drug treatment, harm reduction, and social support.
It's about treating people with dignity and respect regardless of their choices.
Absolutely. The report condemns discrimination and stigma against people who use drugs.
And calls for a compassionate and human rights-based approach to addressing this global challenge.
We need to move away from judgment and punishment.
And towards understanding and support.
It's a powerful reminder that we're dealing with human lives, not just statistics. We'll be back with part 3 of our deep dive into the 2024 World Drug Report, where we'll explore the report's key recommendations and discuss potential paths forward in tackling this complex and ever-evolving global issue.
Until then, we encourage you to reflect on the human stories behind the data and consider how we can all contribute to creating a more just and compassionate world for people who use drugs and those affected by drug use.
Welcome back for the final part of our deep dive into the 2024 World Drug Report.
We've covered a lot of ground.
We have.
From, that alarming growth of the cocaine market, the rise of synthetic drugs,
Right.
the unique challenges facing Africa.
The global treatment gap.
Yeah, we've delved into the data, explored those challenges, examined the policy responses.
But now it's time to focus on solutions.
Right. What can we actually do to tackle this global issue?
Well, thankfully, the report doesn't just highlight the problems.
No, it doesn't.
It offers a roadmap for action.
It outlines key recommendations for policymakers, law enforcement, healthcare providers, and communities.
So there's hope.
Eh.
We're not just throwing our hands up in despair.
Not at all. One of the central themes of this report is the need for a balanced approach that combines public health measures with, smart law enforcement strategies.
It's not about choosing one over the other.
Right.
It's about recognizing that both play a vital role.
Exactly. The report advocates for a shift away from solely focusing on criminalization and punishment,
Okay.
which often leads to overcrowded prisons and doesn't address the root causes of drug use.
So less lock them up and more let's help them.
Precisely. The report emphasizes the need to prioritize prevention, harm reduction, and treatment.
Okay, let's start with prevention. The report calls for increased investment in drug prevention programs,
Particularly those targeting young people.
reaching kids before they start experimenting with drugs.
It's crucial.
Yeah. But what kind of programs are we talking about? DARE 2.0?
Not quite.
Yeah.
The report stresses the importance of evidence-based programs that are tailored to specific communities and cultural contexts.
So no more cheesy videos and scare tactics.
Right. We need something real and relatable that will resonate with young people and address those specific risks and pressures that they face.
And it's not just about preventing initiation.
No.
The report also highlights the importance of harm reduction strategies.
Like needle exchange programs and overdose prevention sites.
I know these can be controversial, but the report emphasizes that they save lives.
They do. These interventions have been proven to reduce the spread of infectious diseases,
Right.
like HIV and hepatitis C.
And prevent fatal overdoses.
Right. They provide a critical point of contact for people who use drugs,
Right.
connecting them with healthcare services and support.
It's about meeting people where they are and offering help without judgment.
Absolutely.
And speaking of help, the report stresses the urgent need to expand access to drug treatment.
Right. We talked about that treatment gap earlier with millions of people lacking access to the care they need.
So how do we close that gap?
It's a multi-pronged approach. We need to increase funding for treatment programs,
Okay.
including medication-assisted treatment for opioid use disorder.
Which has been proven to be very effective.
Highly effective. The report also emphasizes the need for diverse treatment options
Okay.
to meet individual needs.
Right.
From residential programs to outpatient services, from individual therapy to group support.
There's no one-size-fits-all.
Exactly. We need a menu of options that cater to those different needs and preferences.
It's about empowering people to choose the path that works best for them.
Right. And it's not just about providing treatment
It's also about addressing the underlying issues.
that contribute to drug use,
The report highlights the importance of tackling the social and economic factors.
like poverty, unemployment, lack of education, trauma, and mental health issues,
We need to invest in social safety nets.
and create opportunities for people to build better lives.
It's about breaking the cycle of poverty and despair that can often lead to drug use.
Absolutely.
So we've talked about prevention, harm reduction, and treatment.
But what about the criminal justice system?
Is there a role for law enforcement in all of this?
Absolutely. Law enforcement plays a vital role in disrupting drug trafficking networks
Right.
and addressing drug-related crime, but the report advocates for a more proportionate and humane response.
So less focus on punishing individual users
Right.
and more on targeting those kingpins running these operations.
Exactly. The report suggests focusing resources on high-level traffickers rather than those low-level users and possession offenses,
Okay.
and it encourages exploring alternatives to incarceration.
Like diversion programs and drug courts.
These programs give people a chance to get their lives back on track.
Instead of ending up behind bars.
Right. It's about rehabilitation, not punishment.
The report also calls for greater international cooperation.
To address the transnational nature of the drug problem.
Drug trafficking doesn't respect borders.
So we need to work together to combat it effectively.
So sharing intelligence, disrupting trafficking routes, coordinating law enforcement operations across borders.
Exactly. And the report emphasizes the need for development assistance to support those countries heavily affected by drug production and trafficking.
Providing economic opportunities, strengthening healthcare systems, promoting good governance.
Right, addressing those root causes.
So it's a holistic approach.
This is a global issue that demands global solutions.
The report lays out a comprehensive set of recommendations, but the key takeaway is that there's no quick fix.
It's going to require sustained effort, collaboration, and a willingness to embrace new approaches.
It's about moving away from punitive measures.
and embracing a more humane and evidence-based approach that prioritizes public health and human rights.
And that brings us back to that crucial point, the importance of a human rights-based approach to drug policy.
Right, drug policy must be grounded in respect for the dignity and rights of all individuals, regardless of their drug use status,
That means ensuring access to health care, protecting people from discrimination.
upholding the right to due process.
It's about recognizing that people who use drugs are human beings deserving of compassion and support.
A human rights-based approach is not only ethical, but it's also more effective,
When people feel safe and supported, they're more likely to engage in treatment
right? Make positive changes.
and contribute to their communities.
It's about creating a society where everyone has the opportunity to thrive.
So as we conclude our deep dive into the 2024 World Drug Report,
We're left with
we're left with a sense of urgency and hope. The challenges are real, but the report provides a clear roadmap for action, and countless individuals and organizations around the world are working tirelessly to address this complex issue.
It's going to take a collective effort to create a world where drug use is prevented, harm is reduced, and people have access to the care and support they need.
We all have a role to play.
Absolutely.
Thank you for joining us on this deep dive. We hope it's been informative and eye-opening
We hope it inspires you to get involved.
in creating a healthier and more just world for everyone.
Remember, behind the statistics and policy debates are real people whose lives are affected by drug use.
Let's approach this issue with empathy, compassion, and a commitment to finding solutions that work for everyone.